Good morning. I'm Williams, the Chief Nursing Officer at Tawam Hospital. And today I wanted to talk to you about artificial intelligence. Artificial intelligence is the use of computer systems to take over some of the functions normally undertaken by the human brain. Since the third industrial revolution in 1969, we've seen a proliferation of artificial intelligence. A good example is the simple calculator. This is an example of artificial intelligence. It's small, compact, and it does many of the functions that our brain would normally do if we didn't have the calculator. This is a small calculator. Calculators during the 1960s would have taken up the size of this room. So it just goes to show how advanced we have become as human beings, as researchers, as consumers of artificial intelligence, to get a massive calculator to this size. Artificial intelligence in healthcare is not a new thing. In fact, since the third industrial revolution, healthcare has been one of the big beneficiaries of the proliferation of artificial intelligence. So I'm in our intensive care unit. This is one of our ventilators. It has a computer system to do a lot of the thinking for the technicians, to monitor how the patient is managing when they're on the ventilator. Our intravenous pumps tell us the right dose of drug to give to the patients. It makes sure that we connect all the component parts correctly and the patient gets the dose that they need. This infusion pump has what they call a brain, which is a nice term for that part of the infusion pump because it is an artificial intelligence that does a lot of our thinking for us. Then we have hemodynamic monitoring, which have just become so sophisticated, become so smart to do a lot of the thinking and monitoring for us as clinicians, to help us with our day-to-day lives, to help improve the care of our patients, and in many cases save their lives. So why are we talking about artificial intelligence if it's something that we've already got used to over the last 50 years? Well, the World Economic Forum announced in 2016 that we're already in the fourth industrial revolution, only 50 years after the third industrial revolution. And the reason they think we are in this next phase of humanity's journey is that we now have drones, we now have nanotechnology, we now have robotics. The sophistication of our world and the way in which we use technology is rapidly advancing, far greater than any of us thought would happen just 5 or 10 years ago. And in healthcare again, we are going to be the greatest beneficiaries of this new artificial intelligence. With the robotics, with the nanotechnology, with the new genome studies that now make genome technology available to the average consumer. In fact, it only costs $1,000 for me to get my complete genome studied. This is the technology that is going to revolutionise the way in which we care for our patients, save their lives, and ensure they have a greater quality of life. We don't even know what the next 10 years is going to offer us. But what we do know is that as health professionals, we need to be ready to embrace this technology, to apply it to our healthcare system, and to give our patients the best possible opportunity for survival, recovery, and improved quality of life.